Phase 2's goals are primarily to increase shoulder range of motion and improve shoulder girdle neuromuscular strength. You'll notice that there is no specific strengthening exercises for the glenohumeral joint during this phase, as we still need to be very mindful of the healing musculotendinous tissue. There is, however, increased demand on these muscles through many of our other exercises, and so we must be careful with our choices and watch the patients are not overloading the shoulder, especially into those abducted planes of motion. Pendular exercises are continued in this second phase, and if you've not added the retraction and protraction to the exercise, this should be done now. So active assist range of motion exercises are continued into phase 2. They can be progressed into greater ranges of motion as your patient is able to do so without pain. Good position still to be working in is supine, as it's going to stabilize the trunk and the scapula. The big addition in phase 2 is that patients can now start to work into that abduction range. So when patients can move through range without pain and without compensation, they can progress from active assist to active range of motion. It's quite common to be working both types of exercise at this stage. What commonly happens is patients can elevate their arm well to a certain degree, and then the last 50 or 60 degrees of elevation, they start to bring in those cheating patterns. And again, those are often that scapular protraction and elevation, or thoracic extension and rotation. So encourage your patients to work in their proper range that they can do with that proper rhythm, but then concentrate more specifically on those top positions with exercises like, ball or towel on the wall, and really encourage the patient in those overhead positions to try and, again, get the timing right with the scapula and the arm. So in phase 2, patients can begin to do some more functional type of exercise that incorporate the entire upper extremity chain. These exercises tend to use more of a combined movement pattern versus the isolated ones, and they demand strength from not just the proximal segment, but getting into more of the distal smaller segments as well. So a good suggestion is what this patient's doing, where in a standing position, you can have the patient concentrate initially on good posture and have them set the scapula where you want them, and then to maintain that again while they're doing a little bit of rolling of a ball or a towel on the bed surface. You can then change it a little bit by having the patient step back, and of course then we're working into more leverage, and that becomes a little bit more challenging. Other ways to change it are to change the starting position so that you're working in different positions and different planes of movement. PNF or diagonal patterns work really well here as well, where you can combine things like elevation and rotation and cross flexion and adduction. These are motions that we do several times throughout the day, so they're good to start incorporating at this stage. They can be done in supine, sitting. You can have your patient seated on a physio ball. You can progress to standing to bring in a little bit more of the core, standing on one leg, and so on. At this stage with this repair, you want to probably just use the resistance of the arm to begin with, and again really encouraging that proper timing so the patient with good posture brings the blade back and then the arm, and practices that rhythm before we add in any resistance. The focus of scapular stabilization exercises in phase 2 is to begin adding distal mobility to the stable proximal segment. There's many ways to do this. Even thinking about having your patient integrate scapular stability into day-to-day life is important. This can include things like walking, eating, work at the computer. All those things work really well. So some physioscapular stabilization exercises that can be done include rolling a ball either on a countertop at this level or onto a wall surface. The idea with this exercise is again to promote that proximal scapular stabilization and to hold that position while the arm is being moved in the position it is. When you're in standing and you're in these overhead position, it demands a lot more range of motion and trunk stability, so you need to watch that your patient is able to do this without compensation. So you can also do more traditional rowing type exercises to work retraction and depression. The most important thing here is the timing of those muscles that are contracting. So your first step is always posture, as we've said. Your next instruction to the patient is, without moving their arms, to pull the blades back into that position. To hold that position now, bring the arms back a little bit. Keep the blades still while the arms are released back, holding this, and then releasing the shoulder blades. It's really important that we teach patients on an exercise that's a little bit easier like this how to establish that timing, because it becomes really important in our more difficult overhead exercises. So protraction exercises can be added in phase 2, and a really good one to start with is, again, with your patient supine, have them flex their arm to about 90 degrees, and then the instruction is to think about elevating the arm up or extending up. This should come from the shoulder blade. Watching, patients will want to use their upper traps and to try and cheat to hike that up, so you want to guide them to make sure that that's a straight up motion, so they can protract and hold and then release it back, get the feel of both the up and down. And after they get a good sense of how to do this, then you can add little circles to the end while they hold it in that up protracted position, writing the alphabet, any of those things. The same motion can be done now in standing, and so with the tube attached behind the patient, the instruction again is to try and extend the arm forward without lifting. So a little bit lower to begin with, and really thinking about that motion coming from the scapula, coming forward, and to hold. And then as they get stronger, again, you can add those little circles or figure eights or whatever you want on the end while they maintain the scapularly protracted position. So closed kinetic chain exercises are added in this second phase. These exercises work really well to improve range of motion, that neuromuscular input to the cuff and the scapular muscles, and patients feel really comfortable because that endpoint is stable. Again, there's lots of different ways to do closed kinetic chain exercises, but choices should always be made based on the patient being able to do the exercise without pain and without compensation. So in phase 2, with the closed kinetic chain, we are allowed to do an exercise like this, where we're weight bearing onto the ball, good posture, good scapular positioning. The important thing to remember is that we still cannot load into abduction, so you must instruct your patients to go through range just into a flexion plane of motion and back, and then into scaption, but not straight out sideways into abduction. Okay, and again, you can add those different degrees of scapular retraction and protraction to this exercise when your patient is able. You can also do closed kinetic chain exercises with your patient on all fours. And again, the strong, stable spine to begin with, head in a neutral positioning, a little bit tucked down. You can have the patient in different degrees of retraction or protraction. And then with this exercise, following a rotator cuff repair, we are allowed to do our weight shifts forward and backwards. And so again, you can go into as much range as the patient can comfortably. But we're not allowed to go side to side because, again, that abduction force through the joint places too much stress on the healing tissue. Other ways you can do closed kinetic chain include exercises against a wall, doing a gentle sort of wall push-up. You know, again, the ball on the wall, all of those things fit really well.